In this lesson, we will discuss the integumentary system, which includes the skin, hair, and nails. The skin plays a major role in the concept of body protection. After this lesson, you will be able to compare the structures and function of the epidermis, dermis, and subcutaneous tissue, perform risk assessment for skin, hair, and nail problems, use proper terminology to communicate skin assessment findings, distinguish between normal variations and abnormal skin manifestations with regard to skin color, texture, warmth, and moisture. Identify alterations in the integumentary system. Identify the aging process role in regards to the integumentary system. And to identify cultural considerations and modify assessment techniques to assess integumentary changes of patients with different skin tones. Why do we have skin? The skin is the largest organ of the body. The structure of the skin consists of epidermis, the dermis, and subcutaneous fat. Each layer has unique properties that contribute to the skin's ability to maintain its complex functions. These functions are: for protection, skin is the first line of defense for protection by protecting against foreign invaders. Our normal flora fights off certain microorganisms. Intact skin has barrier functions, alarm functions, and even combat functions. Special cells, Langerhans cells, eat up foreign substances such as antigens that invade when the skin is broken, which alert the whole immune system that there is a problem. Skin also plays a major role in homeostasis. When skin is intact, it also helps regulate body temperature and maintain the fluid and electrolyte balance. The skin is a sensory organ, and the sensory receptors allow the patient to be able to report subjective skin sensations. The skin also synthesizes vitamins. One vitamin is vitamin D. And if the skin is in good health, the patient can have a good psychosocial function. Page 454 of your textbook provides a table labeled 26-1 that gives a detailed depiction of the structure and their functions of the integumentary system. A thorough history and physical examination is included for the integumentary assessment. This assessment includes demographic data, which can help explain causative or aggravating factors that can contribute to skin problems. Also, socioeconomic data. This helps identify environmental factors such as has there been recent travel, what are the hygiene protocols for this patient, and whether they've had a lot of sun exposure or limited sun exposure. The drug history provides, information based upon any prescriptions they may be taking or have recently taken, over-the-counter medications, or illegal drug use that can contribute to skin problems. You want to assess allergies. Are they allergic to a lot of common environmental things, laundry soap, body wash, shaving gel, even maybe some cleaning solutions? As you assess the nutritional history, you want to look for protein deficiencies. You also want to assess if there's a possibility of a family history of psoriasis, keloids, or skin cancer. If they are having current health issues with skin, you may ask, when did the rash begin? Or what makes it better? What makes it worse? Has it spread? Are there any other symptoms? Does it itch? Does it sting? Does it burn? Look for changes in color and vascularity, presence or absence of moisture. Do you note any edema? Look for the ABCD of skin lesions: asymmetry, border irregularity, color variation within the lesion, and diameter. Is it greater than 6 millimeters? Are they primary lesions? initial reaction to the problem, or secondary lesions. The primary lesion has changed and usually gotten worse. Describe the lesions. Are they generalized or local to one area? Assess the skin integrity. Presence of petechiae. Is there bruising, ecchymosis, tattoos, piercings, scars? Inspect all skin, including the scalp, the hair, the nails, and mucous membranes. Overall cleanliness too. Also, while inspecting the skin, you will inspect through palpation. You want to assess for a macular rash, which is flat, a papular rash, which is raised, and you will also assess skin turgor. Where do you assess skin turgor on older adults? Yes, on the forehead or the chest. Common clinical findings in skin palpation can be located in your textbook, page 464, table 26-4. Please review this table. Table 26-2, page 459 of your textbook provides information related to common alterations in skin color. This table here on this slide depicts the lesson, provides a brief overview of the alteration, underlying cause, location, and significance of altered skin color. The RN will describe changes in skin color by appearance and describe whether the changes are general or confined to one body region. Color changes can be seen most easily in the areas of least pigmentation, such as the oral mucosa, the sclera, the nail beds, and the palms and the soles. The process of aging begins at birth. Changes in physiology progress with aging. The skin also undergoes age-related changes in both the structure and the function. These changes are decreased epidermal thickness, decreased epidermal mitotic activity, decreased epidermal mitotic homeostasis, increased epidermal permeability, decreased Langerhans cells, decreased active melanocytes, hyperplasia of melanocytes, decreased vitamin D production, flattening of the dermal epidermal junction, decreased dermal blood flow, decreased vasomotor responsiveness, decreased dermal thickness, degeneration of elastic fibers, benign proliferation of capillaries, reduced number and function of nerve endings, thinning of the subcutaneous fat layer, decrease in the amount of hair follicles and the rate of growth, a decrease in active melanocytes in the follicle, a decrease in the rate of nail growth, a decreased blood flow beneath the nail bed. They will experience nail thickening, a decrease in sebum production, and a decrease in eccrine and apocrine gland activity. As you can see, there are a lot of physical changes to the aging skin. Review chart 26-1 on page 455 to 456 in your textbook for detailed information that's related to the changes in the integumentary system related to the aging process. Palpate and inspect a hair for general appearance, cleanliness, distribution, quantity, and quality. Hair is normally found evenly distributed over most of the body surfaces. Items to assess for are lice, dandruff, hirsutism, greasy hair, dry hair, or brittle hair. Check the color of the nails, the nail shape, the thickness of the nails. Are the nails brittle or soft? You will also inspect for lesions. And you will also assess around the nails for acute paronychia or chronic paronychia. There are common alterations in nail color that can be found on page 465 of your textbook in Table 26-5. This table provides the alteration, clinical finding, and the associated significance. Review this table in your textbook. There are common variations in nail shape. Let's see if you can guess these. What is the variation for this nail shape? This would be considered a normal nail shape. Okay, next. What is the variation for this nail shape? This nail shape would be considered early clubbing. Okay, what is the variation of this nail shape? This variation would be considered late clubbing. Has anyone ever seen this shape of nail? So what variation would this shape be? This variation is known as koilonychia, also known as spoon nails. What would this variation be known as? This variation is known as Bow's groove. And another variation? This variation is known as pitting. This slide provided you with images depicting the variations in fingernail shapes. On page 466 of your textbook, Table 26-6, there is information related to these nail shapes, including the clinical findings and the significance. Review this table in your textbook. There are cultural considerations when performing the skin assessment. How do we assess for pallor? You will inspect the mucous membranes for ash gray color. Inspect the lips and the nail beds. Are they paler than normal? Check for the absence of underlying red tones. In brown skin, you will assess for the presence of yellow-brown skin tones. And in black skin, you will check for the presence of ash gray skin tones. In cultural considerations, how will we assess for cyanosis? Well, we will assess for subtle color changes, such as, are the lips gray? Is the tongue gray? Do the nail beds have a bluish tinge? What about the conjunctiva? Does it also have a bluish tinge? And then you will also assess for the palms and the soles and whether they have a bluish tinge. Other clinical manifestations of cyanosis can be tachycardia, hypotension, changes in respiratory rate and rhythm, and changes in level of consciousness. What are the cultural considerations when we assess for inflammation? We assess for warmth, tenderness, and edema. So how will we assess for jaundice when doing the skin assessment, taking in cultural considerations? We will assess the oral mucosa, the hard palate section, the palms of the hands and the soles of the feet, and you have to be careful because the conjunctiva and the sclera can be misleading, and that is due to fat deposits. Diagnostic assessments include labs such as cultures checking for fungal, bacterial, or viral infections. When you treat a fungal slide with KOH, which is potassium hydroxide, and stick it under a microscope, it will show branched hyphae that is diagnostic, called a positive KOH test, and can be treated accordingly. Or there may be skin biopsies. The punch is the most common technique. You want to shave off the portion that is above the surrounding tissue, and then you'll do a deeper incision, which is excisional, often with some surrounding tissue, and it requires sutures to close it. And then there's also the diascopy. You want to push down on their skin with a glass slide to cause blanching to further view the lesion, and this eliminates the masking that might be occurring from erythema. We also have the handheld ultraviolet light for assessment. Use a black light to examine skin. Certain infections will glow blue, green, or red. Okay, when discussing skin biopsy, we said the most common was the punch biopsy. It is usually a 2 to 6 millimeter plug that is removed, is closed with 1 or 2 sutures, or left open to heal. They'll shave the area for the biopsy, and then the portion of the skin is elevation is removed with the scalpel. And the patient prep, you want to explain it is a minor procedure and there is minimal or no scarring at all. For this procedure, you're going to need a specimen container and then a sterile field is needed. Bleeding is controlled, may use local anesthesia, and they will require a dry bandage for at least 8 hours. This concludes the lesson of integumentary assessment. If you have any questions related to course content, contact the instructor.